Greetings to our respected subscribers and guests of the channel. One common misconception about prison is the belief that staying in the medical unit of a pretrial detention center is far more comfortable than being held in a regular investigative cell. This idea comes from incorrectly comparing stories about Stalingrad labor camps with the realities of the modern prison system. In the hospital wards and work detachments of that era, so-called camp points, satellite camps within the Gulag system, prisoners had to work 10 to 12 hours a day in mines or kitchens just to earn their food rations. Against that background, ending up in the medical unit felt like heaven. The ration there was smaller, of course, but there was no work at all. You could simply lie there and stare at the ceiling, doing absolutely nothing. In modern penal colonies, working conditions are no different from those at any regular factory, and there isn't even enough work for everyone. You don't have to earn your food ration, you'll get it no matter what. Prisoners under investigation don't work at all, and even without the medical unit, you can lie around and spit at the ceiling. So blindly trying to get admitted for treatment is not necessary. Great writers were already joking through tears about state-run medical care long ago. 150 years ago, Nikolai Gogol wrote, "We do not use expensive medicines. A simple man, if he dies anyway. If he recovers anyway. That's how it's arranged. That's the order of things. They recover like flies. A patient barely enters the infirmary and is already healthy, not so much because of medicine, but because of honesty and order." Getting sick in prison is highly undesirable. A prisoner constantly whining about his illnesses is such a familiar sight that no one pays attention to him at all, neither the administration nor his cellmates. Sometimes they only start noticing when he's already gone cold, meaning dead. If illness does strike, and who is immune to that, you must take measures so you don't cool down. First and foremost, you need persistence. Use every possible opportunity to report your condition. Every prison is characterized by poor organization and a shortage of people capable of creating and maintaining proper systems. The guard on duty, post controller, you complain to will most likely pass the information to no one. He'll think, the nurse probably already knows, why bother? The nurse will think the doctor already knows, and the doctor may not be thinking about it at all. Here's a harsh example. In an investigative cell, one prisoner slipped on the parasha, literally toilet bucket, meaning an open toilet in the cell, and broke his hip. In civilian life, he had been a drug addict. His bones were weak, so the leg broke from a minor impact. For 4 days straight, his cellmates asked the on-duty guards to call a doctor. Each guard, absolutely conscientiously and absolutely stupidly, called the medical unit. But since the switchboard connected him to another guard in the medical unit corridor, he passed the message to him. That guard, just as conscientiously and just as stupidly, passed the message to the first doctor he ran into. The doctor, busy filling out medical charts without understanding the essence of the problem, muttered that the building where the patient was housed had his own doctor.
In short, everyone was doing something, but nothing came of it. On the third day, some woman in a white coat ran past the cell. The guard told her about the situation. From a distance of about 5 meters through a barred door, she carefully looked at the sick man and asked what was wrong. The prisoner said his leg hurt. What else could he say? She gave him 2 tablets of analgin, basic painkillers, and disappeared. Luckily, on the 4th day, the scheduled inspection was by name rather than by head count. The prisoners had to leave the cell. One of them didn't come out, and only then did they finally learn about the fracture. Why didn't the prisoners report the problem to the senior officers during evening inspections? Why didn't they tell the roaming supervisors? Who knows? Were they embarrassed? Or maybe they did tell them. Then they should have been shouting. If not for the name-based inspection, the poor guy would have just died there. That's why attention from medical staff must be demanded using every available means. Once you manage to see a doctor or a medical assistant, make sure you clearly understand your diagnosis and write it down. Otherwise, you'll forget it. Write down which medications are required for treatment. Through your lawyer or investigator, ask your relatives to bring what's called a medical package. Contrary to popular belief, the investigator, called in prison slang sledak or sledachka, literally investigator, male or female, usually cooperates willingly within the law. Their attitude toward prisoners is generally calm and neutral. They don't personally wish harm on the detainee, they're just doing their job. Medicines from relatives are extremely important because the prison most likely won't have the necessary drugs. And that's not the fault of the local lepili, literally quacks, slang for prison doctors. Nobody sells medicine on the side, they simply don't receive it. Sometimes, as part of humanitarian aid, expired medications arrive from Europe. Prison doctors gather for a consultation and try to translate, for example, from German, what exactly they've received. With difficulty, they translate something like medicine for treating diarrhea in pigs, analyze the composition, and decide that prisoners can take it. And it helps. You shouldn't conclude from this that a Russian prisoner is the same as a German pig. He's not. The German pig has a choice of medications. Our prisoner does not. When your parents bring a medical package, you won't receive it directly into your hands. Keeping medicines in the cell is forbidden, but they will show them to you. Remember, or better yet, write down when the request was filed and which medications were delivered. Your medicines won't be blatantly stolen. That's not customary in prison. But doctors and nurses change, and confusion can happen. That's why you must clearly know how many injections you've received, how many pills were given, and how many enemas were administered. This was the channel, The Prison Code, Russia. Like the video, subscribe to the channel. Good luck to you.